everyone, welcome to another exciting episode of Service Hour. My name is Mati Fati. I'm going to be holding you down this segment, but of course, not alone because I have with me the very beautiful Jem. Hi,
Hi, how you doing?
I'm fine. How are you doing as well?
I'm good.
It's always exciting to have you here.
Same as me.
I think I said in the last episode how I missed you because we haven't had the time to do this
Yes,
together, but
yes,
we're back now
yes,
fully.
fully on
Yeah.
ground.
So for this episode, we are going to be talking about a very integral part of the country, which is the Nigerian health sector. Everybody, every individual, parents, like if you're a human, even
Exactly.
animals, they need healthcare.
Mm-hmm.
So we are going to be talking about the Nigerian healthcare system. Everything you need to know from start to finish. So you want to stay with us on this episode to the very end of this video. We would be starting with a little backstory of what it used to be, what it has been, and what it is right now. And Jem will be giving us that backstory.
With pleasure.
Yeah.
So as always, before or pre-colonial times, what we had as the health system was just basically traditional and spiritual response to everything illness. I think we still have a little bit of that here, the abo factor.
Yeah.
So there were leaves and traditional concoments that you just take to relieve yourself of any pain or any illness,
Yeah.
and all of that. So that was what we had, and then the colonial time, the colonial masters came with their Western medicine. So, but it was a bit too much for us to grapple with at that point because Africans are very much rooted in their traditional affairs.
Yeah.
So just transplanting the traditional treatment or mode of treatment with the Western medicine was a bit tricky. That is why I would say that we still have the traditional treatment still very prevalent in the society today,
Yeah. Very true.
right? So after the colonial times, I can say that to a large extent we inherited a bit of a structural, not so well structured health system, right? There was the need to have established a system that work or that would how do I say it now, that will attune to the needs of the citizen, right?
Yeah.
But they were not so prevalent across the society. We had it just in urban areas. So the rural areas were still
Lacking.
yes, and they
Yeah.
were still resorting to the traditional means of treatment.
Mm-hmm.
And if I would say so, I think it was even cutting. Okay, there are some persons that believe permanently in the traditional systems. I don't even. It's
Yeah.
not even an argument. I
Go
want to get
into,
into,
yeah.
because you will still see some people that will say no
It
to
doesn't
Western
work.
medicine.
Yeah.
Yeah.
Stuff.
So anyway, obviously with everything there were revolutions, reforms, and all of that, and then we had more established hospitals coming up in more states, in more regions, and then but then obviously there were lapses and lacunas that needed to be filled, right? So 1990s, 2000s, we had the establishment of the Nigerian health insurance scheme, because prior to this, the nature of the illness or whatever it
You
is,
have to pay everything.
yes, out of your pocket. And the government sort of how best to aid or alleviate financial burden on the citizen, and then the national health insurance scheme came, and this was basically just we take contribution from this, you pay a certain amount monthly, and then you're insured for certain illnesses or certain operations or surgeries or procedures and stuff like that. Then obviously with everything they also had issues, right? And then it
Okay.
was more central, so they needed to decentralize it, and then there came state insurances, state health
Yeah.
insurances,
Yeah.
like you will have in FCT health insurance, that's FHIS,
Yeah.
right?
Yeah.
So this helps to reach a larger group. We had more people enrolling into the scheme, and then we had informal sectors also enrolling. But the major problem we have with the Nigerian health insurance scheme is that not many persons are subscribed to this. I think I would say it's lack of orientation
Yeah,
or lack of,
because certain people, sorry to cut you,
yeah.
certain people think that it's just for, I am certain people. I think that is like just for federal government workers
Not
or
necessary.
state government. Like have to work for the government
No, not
before you
necessarily.
can
There's
access that.
it's a personal, it really like if you are on your own,
Mm-hmm.
an entrepreneur or anybody, like a private, yeah, I think that's what, a private and really section for NHIS or
Oh, okay.
FHIS or whatever state you're in.
Mm.
So you can just say, okay, you walk in, fill forms, I'll be paying for this myself, right?
Every
And
month.
then just like there are some persons that are not even subscribed to this NHIS because they do with the private HMOs, like private insurance,
Mm.
health insurance companies.
Yeah,
We
yeah.
have Mediplan, we have Leadway Health Insurance. So these persons you still pay out of your salary or whatever to them on a monthly basis, and then they cover certain treatments, procedures, and stuff like that.
Yeah.
So I would say to a large extent that we have moved from very not so good place to a very
Mm-hmm.
great place,
Mm-hmm.
even though
We're still evolving.
yes, and
Yeah.
there's still a lot of places and a lot of spaces to be filled, right?
Mm.
So basically, now we have, thanks to in 2020, COVID came
Mm-hmm.
and then should like touchlight so many areas that we were lacking in health
Yeah.
sector, right?
Mm-hmm.
The quarantines and everything was it was before. In fact, before COVID, we had the Ebola crisis.
Virus. Mm-hmm.
Yes, so this kind of showed so many things and then reforms, and I basically what we have now is we're leaning towards digital medicine, right? So
Yeah.
we're leaning towards how to cater for people with even not being physically present.
Mm.
So all of these are all things that have happened to the Nigerian health system happening, and then obviously we are projecting for a better future.
Very true.
Yeah.
I really liked everything you said, but there's something that struck me when you mentioned digital medicine, how you can, provide healthcare services to people even without them being present.
Mhm.
So I want you to give me a little, paint a picture of how that would work.
Okay, so basically we have what is generally called telemedicine, right?
Okay.
So I've seen this is usually run by private hospitals. I'm not sure if government hospitals are subscribed to this.
Mm-hmm.
So you have a case where is you just call in or whatever means of communication that is available at the hospital, and then you communicate with them.
Tell them your
Yes,
symptoms.
everything, and
Okay.
then they find a way to have you diagnosed of whatever illnesses you're going
Mm-hmm.
through, whatever pains, and then recommend for you
Mm.
ways to go. If you need to be in the hospital,
They'll let you
obviously,
know.
yes,
Mm.
they will get you to the
I feel
hospital.
that's a very beautiful innovation. I
Mm-hmm.
like that. Sounds
Yes, especially
nice.
when you go to general hospitals in Nigeria
Mm-hmm.
and you see.
Oh my God, that can be
In
frustrating.
fact, sometimes I get discouraged. What should I be scared of more? Queues in the bank or queues in the hospitals?
I think they are
Hey,
battling, like they are dragging, they are competing. That's the
it's
word.
crazy.
They are
So
competing.
the availability of a digital platform
Mm-hmm.
to aid sick persons will alleviate a lot of stress
Yeah.
regarding the overburdening the hospitals. And
Mm.
then maybe we could also look into building more hospitals. And but then I didn't want to just get into that. It's not just about building hospitals. What are the infrastructures
Made
that are
available.
available?
Mm-hmm.
What are the equipments available? Right? What
Mm-hmm.
are the machines? What are the top-notch machines
We're getting
available?
there.
We'll get there.
We're
Let me
getting
not
there.
jump the gun, right?
Yeah,
We'll get there.
we're getting there.
So
So
basically,
thank you very much, Jem. I really love that. So what before we go into the challenges that
mhm.
the healthcare system face, what are some of the importance of having a functional healthcare system in the
Hmm.
country?
I will just draw one. I'll just give you one basic thing.
Okay.
With health,
Mm-hmm.
right, and with everything practically in the world comes involvement, technology, and advancement
Yeah,
knowledge. And
yeah.
I think one thing that science affords us is more knowledge to know what's
Mm-hmm.
going on, right?
Yeah.
Before we had established means of catering to illnesses. Imagine I want to paint a scenario where sickle cell, right? Or
Mm-hmm.
just use this as an
Yeah, an
example because
example.
I have very close persons who are warriors of sickle cell
Yeah.
trait. So
Strong people.
not knowing that this is a sickle cell case, you know how many people have died from not having access or not knowing. Okay, this is not just having access, but not knowing what it is because they relied solely on traditional medicine.
Yeah.
And then we lost so many people, but then going to the hospital, running tests, knowing, getting informed about your health situation. There are a lot of things that we would not know by avoiding contact with western medicine,
Mm-hmm.
right? I'll bring in another example, rhesus factor when it comes to getting pregnant and family, creating family, right? Most persons don't know that you and your spouse need to have a rhesus factor compatibility. to have
Okay.
a child,
Mm.
or for the child to survive in a woman's womb.
Yeah.
Now, avoiding contact with Western medicine or
Would
not
not.
going to the
Yeah.
hospital
Yeah.
might deprive you of this knowledge, and then you think
Mm-hmm.
you're just losing your child, or you're not conceiving for just
No
you're
reason.
not knowing that there's actually an explainable and avoidable issue
Mm.
going on.
Mm.
So the importance of healthcare system cannot be overemphasized.
True.
Like,
Very
it's not
true.
supposed to be a debate.
Yeah.
And if you say you want to rely solely on traditional medicine, do you know what quantity of this abo, for instance, you're supposed to take?
No.
Do you know the effect? Do you know if you're reacting, or if you have an allergy to any of the contents of what you're taking, or any of the concomitants you're taking?
Mm.
Okay, now we've learned that taking in bitter stuffs affects the liver.
Yeah.
You know how many people have lost their liver to consuming abo?
They think that it's actually working. Meanwhile, they're
Their
damaging their
children,
organs.
that their teeth, it's not that they don't have white teeth though, but their teeth is now green because of the abo they've consumed.
Yeah.
You have headache, it's abo.
They will
You
bet
have
you with
stomach pain,
it.
is yes, there's abo for bathing, there's abo for teething, for a
Oh
child that
my
is teething,
god.
there's abo for different things.
Mm-hmm.
But you really don't know what this, because usually, basically, a child just comes to the world and is allergic to certain things.
Yeah.
Now you don't know what this child is allergic
I know what I'm allergic to.
to. That's good. Not many persons do. I'm
If
not sure.
I
I'm,
eat
I'm
too
yet
much rice, my stomach would always be swimming. That's my allergy.
I'm not sure. I'm yet to find what I'm allergic to.
Yeah.
I don't think. Anyway, basically that's it. So
Mm-hmm.
yes, healthcare system helps you to, helps generally the population to reduce death rates,
Yeah. Yeah.
and you become more informed of your health system.
Mm-hmm. Thank you very much, Jem. I think that that's a part of it. There are people who abuse like this
Mm,
Western medicine. They
mm,
don't actually know if you're doing that. You have to repent today.
mm-hmm,
You
mm-hmm,
don't know what's wrong with you. You
mm-hmm,
just run in between pharmacies. I
mm-hmm.
want
They
this one. You even
self-medicate.
yeah. You don't even tell the pharmacist. Oh, I'm feeling like this. Just give me this one.
Even
Give me
telling,
this one.
because there are some pharmacists have actually turned themselves to doctors.
Mm-hmm.
You
True.
just the
That
next thing,
too.
I don't think most pharmacists will just open a pharmacy store. In fact, even nurses, will open a pharmacy store and then turn themselves to
To doctors.
doctors, and then you just say, so you get headache and belly pain. Okay, wait now. I'm going to go cure am for.
Oh my
They will
god.
just, and that
Yeah.
is, you don't know it. But I'm here to tell you today that that is drug abuse,
Mm-hmm.
like on a flat rate. That
Yeah.
is drug abuse. You need to be tested.
Mm-hmm.
You need to go for a test
Yeah.
to actually establish what is wrong with you before starting a treatment plan. Do you understand?
Especially if your symptoms are severe,
Yes.
especially that. I like pharmacies that operate based on prescription. If you don't come with a doctor's
Yes, they won't attend
prescription,
to you.
nothing.
Talk not to those
Yeah,
pharmacies.
yeah, I think
Like,
that's
you're
beautiful.
doing good. You're doing us a very good.
Huge favor.
Yeah,
Hmm.
basically.
Yeah. So me, I'm learning a lot. So far, I'm learning a lot. Thank you so much, Jem. I
Likewise,
feel like it's an honor to have you on
no,
set.
no.
Thank you. So we would be talking about some of these challenges that these healthcare systems in Nigeria,
Hmm,
hospitals, what they face,
hmm.
and you're also going to
It's
shine light on
numerous.
that.
It's numerous.
Mm-hmm.
But basically, what we'll start with is corruption.
Mm.
Like, yeah, corruption and mismanagement of funds, right? So there are so many times that there are policies that are made or created to see how these hospitals or hospitals in Nigeria are fully funded,
Mm-hmm.
well equipped to cater to the needs of the citizen. But unfortunately, somewhere along the line, there's mismanagement, there's corruption, and you see that these places, it's sad to find that there are hospitals that they will still tell you that they are not able to run certain tests because they don't have certain machines.
Do you know what
In
is even
21st
worse?
century,
Do you know what is worse? When you go to a hospital and they'll ask you to come with your syringe. Like, are you for real? I
seriously,
should come with a syringe.
because these people are not properly funded.
Mm-hmm.
It's not like as if I think we will need to investigate to find, but I'm sure to a large extent that the government is making up, even maybe not 100%. They're
But
not.
they're trying.
Yes, but somehow along the line, the channel that this money is supposed to follow is a broken pipe that is
Yes.
leaked, that the money is leaking.
The phones
Because
just
I
they
don't
are
understand
siphoned.
why. Yes, I don't understand why we are still having cases of hospitals that are underfunded in 21st century, knowing fully well the importance of health
Mm-hmm.
to the nation.
Yeah. Especially the primary
Mhm.
health system. And I feel like the best way to measure the health of a government is
Mm.
by the primary health sector, people at the
Exactly.
grassroots.
Yes.
Sometimes the major cities, they have good hospitals, they have
Mm-hmm,
good
mm-hmm,
doctors and
mm-hmm. You
infrastructures,
know,
equipment, but then the primary health sectors are suffering.
mhm. And basically, these primary health sectors were established to cater to the needs of the grassroots, right?
Mm-hmm.
So you are not able to move to the cities to access top notch,
Healthcare,
but
yeah.
the primary is like it's close to you. It's supposed to be like something that is readily accessible to you.
Mm-hmm.
But then when you get there, the basic needs
Are not
are not
met,
there.
yeah.
I know some NGOs have tried to see how they can, probably revitalize or rebrand and equip certain primary health centers, but
Mm-hmm.
it's, there's still a lot to be done.
Yeah. There's
Most
a
primary
limit to
health
what they can
care
do.
centers, they are an eyesore. I will not go there to. In fact, I feel like sometimes when you get to this primary health center, you will even leave with more problem than you came with.
I think somebody mentioned that to me. A friend of mine was like, when you go in with typhoid, you come out with malaria.
Because is it the maintenance? Is it the equipment not being properly sterilized before use? There's
Mm-hmm.
so many things. So I think we really need to sit down and look at this because I feel like that is where our constitution should be on.
Yeah.
That's what I think really.
Thank you very much. And from what you just said now, I'm kind of feeling a type of way like not so good, because really what would happen if people are not, like, the people who need
Mm-hmm.
this healthcare
Mm-hmm.
are not having access to them.
Mm-hmm.
They cannot afford to go to private hospitals because the cost is, over the roof. They cannot
Yes.
afford that. So
Yes.
how do you help them to stay alive? Is by making sure that infrastructures are provided, are set up,
Exactly.
are put up,
Mm-hmm.
equipment are in place, retraining. I emphasis on retraining, retraining
Mm-hmm.
of staff, sending them out there to
Mm-hmm.
gain more knowledge so that they
Mm-hmm.
can come and pour it back
Mm-hmm.
into the country.
Do you know the highest percentage of there's this Japa syndrome in Nigeria, right?
Mm-hmm.
Do you know the highest percentage of workforce people
Healthcare, obviously.
exactly, right?
Mm-hmm.
And then when you inquire why people Japa, one of the main reasons they will tell you is I want to have access to a good healthcare system.
Do you know that I'm not a doctor and I don't have any doctor friend, but I feel like it's going to create a hole in your heart having a patient die,
Mm-hmm.
knowing that if certain things were in place,
Exactly
that
where
could have been
yeah, that could
avoided.
have been saved. Yes, yes.
So
And I
is
think
valid.
the doctors really they do care about their patients, right?
Mm-hmm.
So and but then they are helpless.
Yes, they can only work with what they have available.
And do you know that is why some doctors have gone out to establish their own private hospitals? They'll be like, you know what? If it were my own,
I'll
I
do
would
it
invest
better.
there, yeah, and
Mm-hmm.
things will be taken care of better.
Mm-hmm.
And that is why they have private. Most doctors have private establishments.
Yeah, very true,
Mm-hmm.
very true. But then the cost of these private hospitals are not
Ooh,
affordable. Honestly, let's just be real, they are not affordable.
exactly.
Anyways, if you're watching to this point, you cannot afford private health sectors, you cannot afford to go to a private hospitals, there are many options. In as much as the government owned hospitals or state owned federal hospitals, what have
Yes.
you, are not up to standard, they're
Mm-hmm.
trying their best. They've
And I
gone
want
through several reforms.
yes,
Yeah.
exactly. And I want to bring it to them that this notion, I think one of the things that I mentioned earlier was having orientation.
Mm-hmm.
This notion that it's only people, even if you're not working, maybe you're an entrepreneur or you're self-employed, whatever, you can register for NHIS or your state health insurance and
Yeah.
be and enjoy from it. Or look for any pocket friendly health insurance scheme that you can just I think it saves a lot. Not
Mm-hmm.
having to imagine going to sometimes you go to the hospital like 10 times and you have to be out of pocket. But it's going to be a lot easier for you if you are under an insurance scheme that
Mm-hmm.
takes care of you, at least your basic
Yeah.
hospital visits.
And then I know somebody watching that's going to be saying, oh, but I don't have that sickness. Why would I go and be wasting my money? They feel like this monthly stipends that they
Mm-hmm,
have to pay
mm-hmm,
is too much, because according to, like me, I barely fall sick. So somebody who is like me might be
mm-hmm,
saying, oh, I'm just wasting this
mm-hmm,
money after
mm-hmm.
all, I don't fall sick. You have to plan for eventualities.
Exactly. That's the word.
Mm-hmm.
Eventualities. Because God forbid something, they say when it rains, it was
Mm-hmm.
something and decides to happen and it now comes on a grand scale. you will need the creation of an insurance scheme. I
Very
promise you.
true. Very
Seriously.
true. Okay, that's been a lot. That's
Yeah.
been a lot, really. Not just the healthcare system have challenges,
Mhm.
even patients who are exposed to these healthcare systems experience challenges on their own part.
Yeah.
So we are going to be discussing some of these challenges that patients have had to
Hmm.
encounter or endure.
Hmm. The one that is
Very
um
personal.
very personal to me, I even want to mention is, I think, I don't know, I know many persons have put out their voice to this, and I don't know where we're at this point.
Mhm.
But can you people tell me, or can anybody tell me why somebody that was shot or stabbed will not be attended to until there is a police report?
That's there.
Like, we've lost so many lives because of
Mhm.
this. I wonder who came up with that
I
law
wonder.
and what was supposed. I know, honestly, I understand that it's
I
all
don't
in a bit.
understand.
No, it's
I
all
don't.
in a bit to reduce or curb criminality in the
Do you know
society. I can
what
understand
could
it.
have been done in a situation like this? What they would have done is save the person. If this
Mm-hmm,
person is a criminal, you can
mm-hmm.
lock up that person. You can, even if the person has to be penalized by death, after
Yeah.
you save the person, they can go and kill the
Or
person.
you don't release the person from your care
Mm-hmm.
until an enforcement or a
Comes there, but
do you
save the
understand? Like,
life
I think that's what is
first.
unobtainable outside the country. You will see
Yeah,
them, even when the police is
you
trying to
can
say,
be
they'll tell
chained
you,
to your
no,
bed.
I would attend to my patient
Mm-hmm.
first. Like, the patient life comes first before any other thing, even if it's a criminal.
What they can
Treat.
do is even, handcuff the patient to
Mm-hmm.
the bed.
Or whatever. Just treat.
Yeah,
Please, let's move towards treating whatever gunshot wounds or stab wounds before we ask questions.
yeah,
Please,
yeah,
let's
yeah.
save lives,
Mm-hmm.
right? And then, of course, we talk about underfunding and not having equipment. Not having equipment, proper equipment in the hospital, can lead to
Death of
so many
patients, and
complications.
yeah.
Yes, and these are the challenges that end users face. Recently, someone was telling me a story of how she was at the hospital and they did not have the proper facility to do a scan
Hmm.
for her to know that she had what do you call it, a ruptured miscarriage.
Oh my god,
Yeah,
that's bad.
they didn't have the proper equipment to carry out that scan. She had to be referred to another hospital and another
Hmm.
and another until she landed in one at the she was at the brink of death
Oh my god.
when she eventually got a hospital that had the that they were able to discover that was the
Mm-hmm.
problem. So this person could have died
She could
carelessly.
have
Basically, right? The only issue that we as users or as people
patience,
have with healthcare system in Nigeria is we don't have proper equipment. We
Mm-hmm.
don't have proper facilities, you know. And another thing I will say that people suffer from is availability of drugs.
Yeah.
Most times you just recently said, I think last week I was at the hospital and then no guy to you could go find out for outside.
And
I
this is
don't
not to spite anybody. I feel like general hospitals, their nurses are very rude. I think so.
mm,
I really think so.
yes, I don't know why.
I don't really
But
know
some
why.
are nice, or some are really nice. Some are exceptionally nice.
Mm-hmm.
Yes.
But
I remember
the rude ones are really
I
rude.
remember my sister was hesitant about, she will say I don't want to go to general hospital or even any hospital that is not, proper and prim, because
Yeah.
she doesn't want any nurse to be rude to her in a very quick. Imagine being ill and somebody is rude on top of it.
I saw a video recently on TikTok, and then it brought back a memory for me where she was talking about when she went into labor, the hospital that she was taken to,
Mhm.
they treated her like she was a baby, and she felt like, oh, this experience should just go on. And then it reminded me of one time somebody very dear to me was sick, and then we went to this private hospital. Gem. I I wanted that person to get like to get
Well,
well
yeah.
fast, but then I was enjoying
The
everything going on.
treatment,
I didn't
yeah.
even feel like I was in a hospital for
Yeah,
real.
I don't know why we get that mostly in private hospitals.
I
I think we
don't.
get, no, sorry, I think we get that in private hospital because obviously they want to maintain or establish a
And then
very good customer relationship. Yes,
the money you're
obviously.
paying, they're paying their staff well, so they are always in
But
high
then this
spirits
in government hospitals we have this I don't care. Jane,
attitude,
what is it that you're going through that somebody has not gone through before? That's what they will tell you. Especially,
and
no
it's
be
so
better you carry
bad. It's so
waiting.
bad.
Do you understand?
Hmm.
But we need to start looking. I think that they need to start looking at how to better train the nurses and
Hmm.
other nursing assistants or doctor assistants to be warm and receptive of
Mm-hmm.
patients. These people
Mm-hmm.
are already suffering.
They are going through a lot.
Ordinarily, they will not be in the hospital
Yeah,
if life is okay with them.
very
So
true.
you need to be, maybe we need to look at,
Warm.
mhm,
Yeah.
basically, and then, like I said, the reasons people are leaving, one of the major reasons people are leaving the country is because access to a better care system,
Mm.
healthcare system. So imagine us have a solid care system. I think we would actually retain more people,
Mm-hmm.
more of the good ones that are going.
Yeah. And then I am big on, sending them out there, let them gather all the necessary experience, let them work with this
Yes,
equipment, let them know
yes.
how to handle situations, then they come back.
Mm-hmm,
You can pay for this sponsored education, I guess.
mm-hmm.
You can, let them see the word for what it is, and they know that, okay, there's nothing much of a big deal out there. Then they gather that expertise and bring it back home.
Exactly,
Yeah.
exactly.
So
And
I
then we're
feel,
looking at, okay, sorry to
no,
cut you
that's
short.
good.
You can look at having partnerships with private hospitals as well, like government hospitals. Like I like what they did with Nissan and Gariki General Hospital, right?
Okay.
Having this partnership will just bridge the gap between the discrepancy or the difference between these private hospitals and general hospitals.
Mm-hmm.
Look at partnerships, look at ways that we can, bring accessibility or healthcare or make healthcare more accessible to citizens in the
Yeah.
country.
And I think something that can be done is orientation.
Mm-hmm.
Prior to this, when you spoke about people that do not work for the government, how they can
Yeah.
be subscribed to the NHIS scheme,
Mm-hmm.
before now, I didn't know about that. So orientations should constantly be carried out so that
Yeah.
people can know
Mm-hmm.
these things for what they are.
Mm.
So they don't just rely on, okay, this person said, and most of the time it's wrong information.
Yes, wrong information.
Yeah.
Wrong information actually spreads faster than,
Faster,
yeah,
really, it
yeah,
does, it
it
does.
gains more prominence.
Yeah, so while we were talking, I feel like we already mentioned some of the solutions to these challenges, but
Exactly.
just for the sake of emphasis and for you watching right now, Jem is going to be taking us through some of the solutions to these challenges.
So basically, I will start with the government website. It needs to reorientate not just the staff of the hospitals,
Mm-hmm.
right? I'm sure they do this. Like I'm really sure because I've been to hospital where I will see trainings and workshops for either nurses or nursing assistants or doctors. So
Mm-hmm.
I'm actually sure they do this. Maybe they need to do it more. Maybe more often. If they were doing it yearly, they need to like start looking at monthly or stuff like that. So reorientation, right?
Mm-hmm.
And then channeling more funds and more attention to the healthcare system. Ensuring that this like people that make policies here, they travel,
Mm-hmm.
they see the difference. You will hardly see any of them wanting to receive treatment in Nigeria,
Yeah,
right?
yeah.
That's because of what they get outside. But please, can you guys just try and bring what you get outside? Like, bring it home so
Jem
that
is
those of
pleading
us
now.
that, we can have access to this,
Yeah.
so awesome,
Mm-hmm.
please, right?
Yeah. So I think something again that can be done is providing incentives to
Mm,
health workers, because at
mm,
the end of the day, when
mm,
your environment is conducive, you are being treated well, you
mm-hmm,
are happy
mm-hmm,
on your job, you will give your best naturally. You don't have to be coerced, you don't have to be forced, you don't have
mm-hmm.
to be nagged. You just feel you're happy. So what exudes from you is pure
I
happiness
know
to your patients.
I followed the story of someone on social media, a doctor,
Mm-hmm.
and he graduated, he was so excited to
Mm-hmm.
work. But he said in the first place that he worked, he was like, nah, this environment is toxic. As a
Mm-hmm.
doctor, this environment is toxic. And then he said he quickly knew that Nigeria was not for him.
Hmm.
And he had to deprive himself of so many things, save
So
the
he
family.
could leave.
And he traveled and now he's doing well. So yes, I key into this idea of incentive, like making the environment. How many times do we see that the doctors go on strike? A lot of times.
Yeah.
So many times you go to the hospital here, either the doctors are not on strike, the nurses are on strike.
Mm-hmm.
Why? Because they're not. Nobody wants to go on strike. It's only when things
You're
are
not
not.
treated fairly,
Yeah.
then you
So
want
let's
to,
look towards
you know.
making the work environment, paying them. These people have sworn oaths to
Mm-hmm.
take care of lives and to save lives.
Yeah.
So I feel like we should actually pay attention to them and pay them more.
They are essential workers. Like we need them.
Mm-hmm.
We need them.
Especially now that there's a craze for Japa, right?
Mm-hmm.
So paying them more
But
would, keep them. Or maybe those ones that even they've
they'll be
gone
tempted to
to
come
come
back.
back.
Yeah. Another solution to these whole healthcare issues with patients is, this is the final one, and we're
Mhm.
going to close the show, is the Public Complaints Commission.
Exactly.
Yeah. When you come to the Public Complaints Commission, we handle cases of all types,
Mm-hmm.
especially this one that we're
Mm-hmm.
talking about today in this video. You can lodge your complaint online. We have a website. We're on Facebook, Instagram, YouTube. We have offices located at all of the 36 states of the Federation, including the FCT. When you lodge a complaint on the website, an investigative officer is immediately assigned to your case, and then processions just start to get you justice. Yeah.
Basically, so as much as we're advocating for better healthcare system, like they said, the teeth and the tongue and the teeth, they cannot exist without friction, right? So we are just offering you an alternative to violence, because I've seen people who,
I like that, alternative to violence.
yes,
Yeah.
I've seen people who go out like, I came for a particular surgery, but you ended up doing this to me. You understand that there will be grievances between you and your healthcare provider. So just come, instead of being violent or going to, just come
We
to
offer
public
amicable resolution.
yes, and seek redress.
Yeah. So thank you so much for staying to the end of this video. I enjoyed myself and I learned quite a lot. I'm sure you did too. Jim, what do you have to say?
I did. I enjoyed talking about it, and of course I learned.
I enjoy listening to you. Yeah, so we've come to the end of this video. My name again is Mati Fati, and this is Jem. See you again next time. Bye.